Hello everyone and welcome back to EverlastCyber. In today's video, we'll be going through some multiple choice questions on human pregnancy. So without wasting further time, we're going to start right off with question 1. Which hormone is responsible for maintaining the uterine lining during the menstrual cycle? A. Estrogen. B. Luteinizing hormone. C. Follicle stimulating hormone. D. Progesterone. Let's take a look at the options we have. Estrogen is a hormone that helps to rebuild the uterine lining after menstruation and it supports ovulation. However, it does not maintain the lining after ovulation. Luteinizing hormone triggers ovulation and the formation of the corpus luteum, but it doesn't maintain the lining directly. In option C, follicle stimulating hormone stimulates follicle growth in the ovaries before ovulation. However, it is not responsible for the lining maintenance. Progesterone is produced mainly by the corpus luteum after ovulation, and its major role in the menstrual cycle is to maintain and thicken the uterine lining, that is the endometrium, so that it is ready for possible implantation of a fertilized egg. Now, if pregnancy does not occur, the progesterone level drops, and this leads to the shedding of the uterine lining, what we know as menstruation. So the correct answer here is option D. Progesterone is a hormone that is responsible for maintaining the uterine lining during the menstrual cycle. Question 2. What is the term for the release of an egg from the ovary? A. Ovulation. B. Menstruation. C. Fertilization. D. Implantation. Ovulation is the process where a mature egg or an ovum is released from the ovary, and this is usually around the middle of the menstrual cycle. It will be around day 14 in a typical 28-day cycle. In option B, menstruation is the shedding of the uterine lining when no pregnancy occurs. Fertilization is the union of a sperm and egg to form a zygote, while implantation is the attachment of the fertilized egg to the uterine wall. So our answer here is option A. Ovulation is when the mature egg or the ovum is released from the ovary, and then the egg travels into the fallopian tube where it may meet the sperm for fertilization. Question 3. In what part of the female reproductive system does fertilization occur? A. Ovary. B. Uterus. C. Fallopian tube. D. Cervix. Ovary is where the eggs are produced and released, but fertilization does not occur there. The uterus is where the implantation happens, but not the fertilization. The cervix is the lower part of the uterus that opens into the vagina. However, it does not play a direct role in fertilization. Option C, fallopian tube, is where fertilization occurs, and fertilization is a union of the sperm and egg, and this usually occurs in the ampulla. It's also known as the widest section of the fallopian tube. Then, after fertilization, the resulting zygote travels down the tube towards the uterus for implantation. So, our answer here is option C. Question 4. What is the term for the period when a woman ceases to menstruate and can no longer conceive naturally? A. Pregnancy. B. Menarche. C. Ovulation. D. Menopause. Pregnancy is a period when the woman carries a developing fetus. Menarche is the first menstrual blood or the first menstrual period, and this marks the start of reproductive capability. Ovulation is the release of an egg from the ovary during the menstrual cycle, while menopause is the natural biological process that marks the end of a woman's reproductive years. So our answer here is option D. Menopause is usually diagnosed after 12 consecutive months without a menstrual period, and this usually occurs between the ages of 45 to 55. It is usually caused by a decline in ovarian function and reduced production of estrogen and progesterone. Question 5. What is the first organ to form in a developing fetus? A. Heart. B. Brain. C. Lungs. D. Liver. In the human embryonic development, the heart is the first functional organ to form. It usually begins as a simple tube around 3 weeks after fertilization. However, it starts beating by the fourth week in order to circulate blood, supplying oxygen and nutrients to the growing embryo. The brain begins developing early. However, the heart starts to function before the brain is even fully formed. The lungs develop later because they are not functional until after birth. And the liver forms early, but it also starts functioning after the heart has established circulation. So our answer here is option A. That is the first functional organ to form in a developing fetus. Question 6. What is the term for the surgical procedure to deliver a baby through an incision in the mother's abdomen and uterus? A. Forceps delivery. B. Cesarean section or C-section. C. Vacuum extraction. D. Episiotomy. Forceps delivery simply means using a forceps instrument to assist in guiding the baby out of the birth canal during vaginal delivery, but it's not necessarily um, a surgical procedure per se, it's just an instrument that is used. Cesarean section is a surgical procedure in which the baby is delivered through an incision in the mother's abdomen or uterus. Vacuum extraction uses a suction cup to assist vaginal delivery, while episiotomy is a surgical cut made in the perineum to enlarge the vaginal opening during birth, but it is not a method of delivery. So, out of the options, the answer is option B. The cesarean section is performed when the vaginal delivery is risky or not possible. There are various cases where this comes into play. So, in cases of fetal distress, of placenta previa, or if there are complications with labor, that is when the cesarean section is performed. Question 7. During which stage of labor does the cervix dilate to allow the baby to pass through the birth canal? A. First stage. B. Second stage. C. Third stage. D. Fourth stage. The first stage of labor is called the dilation stage. During this stage, the cervix gradually dilates from 0 to about 10 centimeters, and the contractions become stronger, longer, and more frequent in order to help the baby move down the birth canal. The second stage is usually the pushing stage where the baby moves through the birth canal and is delivered, while the third stage is the delivery of the placenta, while the fourth stage is immediate postpartum recovery. That is where the baby and the mother are monitored. So our answer here is first stage. It's at the first stage of labor that the cervix starts to dilate. Question 8. What structure connects the fetus to the placenta for nutrients and waste exchange? A. Amniotic sac. B. Umbilical cord. C. Chorionic villi. D. Placental membrane. The amniotic sac is a fluid-filled membrane that cushions and protects the fetus. but it doesn't transport nutrients or waste. The umbilical cord is the lifeline basically between the fetus and the placenta. It allows for nutrients delivery, gas exchange, and waste removal. And without um, the fetal and maternal blood mixing directly. The chorionic villi are finger-like projections on the placenta that facilitates maternal fetal exchange. They are part of the placenta, but they are not the cord itself. While the placental membrane is a thin barrier that separates the maternal and fetal blood within the placenta. So our answer here is the umbilical cord. That is what connects the fetus to the placenta for nutrients and waste exchange. Question 9. What prenatal screening test assesses the risk of chromosomal abnormalities such as Down syndrome? A. Amniocentesis. B. Non-invasive prenatal testing. C. Ultrasound. D. Chorionic villus sampling or CVS. Amniocentesis is an invasive diagnostic test that is performed at about 15 to 20 weeks, and it provides a definitive diagnosis. It's not just a risk assessment. Now, the question says, what prenatal screening test assesses the risk? So the question is about risk assessments. Let's look at option B. The non-invasive prenatal testing is a blood test that is done on the mother, and this is usually from 10 weeks of pregnancy upwards. It analyzes the cell-free fetal DNA that is circulating in the maternal blood in order to assess the risk of chromosomal abnormalities like Down syndrome, Edwards syndrome, and Patau syndrome. It is non-invasive, so it poses no risk to the fetus. An ultrasound in option C can detect structural abnormalities, but they cannot reliably detect chromosomal abnormalities. While chorionic villus sampling or CVS is an invasive test that is done at about 10 to 13 weeks, and it gives a definitive diagnosis rather than a risk assessment. So, based on the question that mentions the risk assessments, out of the options, we'll be going with option B. That is the non-invasive prenatal testing. Question 10. What is the purpose of the epidural anesthesia commonly used during childbirth? A. Relieving pain during labor. B. Inducing labor contractions. C. Assisting with delivery of the placenta. D. Accelerating cervical dilation. Epidural anesthesia involves injecting medication into the epidural space of the lower spine. And the main purpose of this is to block pain signals from the lower part of the body. So this basically provides significant pain relief during labor, and it allows the mother to remain awake and alert. In option B, inducing labor contractions is usually done with hormones like oxytocin and not an epidural. Option C, assisting with delivery of placenta, is managed through uterine contractions, and sometimes manual assistance is also used. In option D, epidurals do not speed up cervical dilation. Rather, in some cases, they might slightly slow it. So, based on the option, the correct answer would be option A. It relieves pain during labor. Question 11. What is the term for a fertilized egg as it travels through the fallopian tube to the uterus? A. Zygote. B. Embryo. C. Morula. D. Blastocyst. A zygote is the very first stage of human development. So it is a single cell that is formed when a sperm fertilizes an egg. An embryo is a term used from the second week after fertilization up until the 8th week of development after implantation. Morula is an early stage cell division before the blitocyst forms. It is part of the zygote development, but not the name for the whole travel period. While a blastocyst is a hollow ball of cells that implants into the uterine wall. So our answer here is option A, and I've included a screenshot of the various developments. So we can see that the zygote comes first, followed by the embryo, and then we have the fetus, and then the baby. So the zygote is the very first stage of human development. That is where the single cell is formed as the sperm fertilizes an egg. Question 12. What is the purpose of the hormone prolactin during breastfeeding? A. Regulating menstrual cycles. B. Stimulating uterine contractions. C. Promoting milk production. D. Triggering the letdown reflex. In option A, regulating menstrual cycles is the role of estrogen and progesterone. Prolactin has nothing to do with this. In option B, stimulating uterine contractions is the job of the oxytocin hormone. It also helps to return the uterus to the pre-pregnancy size. Prolactin is produced by the anterior pituitary gland, and the main role in breastfeeding is to stimulate the mammary glands in order to produce milk after childbirth. The prolactin level rises in response to the baby's suckling. In option D, triggering the letdown effect is also caused by oxytocin, and this makes milk already in the breast to flow to the nipple. So our answer here is option C. Prolactin promotes milk production. Question 13. Which hormone is responsible for the letdown reflex during breastfeeding? A. Oxytocin. B. Prolactin. C. Estrogen. D. Progesterone. Oxytocin is produced by the posterior pituitary gland, and it is responsible for the letdown reflex, that is, milk ejection reflex during breastfeeding. So, when a baby suckles, nerve signals trigger oxytocin release, and this causes the smooth muscles around the milk producing alveoli to contract and push milk into the ducts towards the nipple. In option B, prolactin stimulates the milk production, but it does not control milk release. In option C, estrogen prepares the breast tissue during pregnancy, but it inhibits milk production until after birth. In option D, progesterone helps to prepare the breast during pregnancy, but it prevents lactation until the levels drop postpartum. So our answer here is option A, oxytocin. Question 14. What is the primary function of oxytocin hormone during labor? Remember to read the question well when you're taking your test. A. Initiating contractions. B. Stimulating milk ejection. C. Maintaining uterine lining. D. Promoting fetal movements. Oxytocin, which is produced by the posterior pituitary gland, plays a crucial role during labor. Now, this same hormone plays a role after labor as well. It also plays a role during breastfeeding. But based on the question, we are going to look at what it does. So, during labor, its main function is to stimulate strong rhythmic contractions of the uterus, and this helps to push the baby through the birth canal. Oxytocin also helps with placental expulsion after birth, and later, that is after birth, it assists in milk ejection, that's the letdown reflex. In option B, stimulating milk ejection is also the role of oxytocin. However, this happens after birth. After birth, oxytocin helps um, to push out breast milk during breastfeeding, which we also know as the letdown reflex. But during labor, it stimulates contractions of the uterus that helps to push the baby through the birth canal. In option C, maintaining the uterine lining is the role of progesterone. And in option D, fetal movement is not controlled by the maternal oxytocin. So, with respect to this particular question, the correct answer is option A. During labor, oxytocin helps to initiate contractions in order to help push the baby through the birth canal. Question 15. What is the primary function of the amniotic sac during pregnancy? A. Controlling hormone levels. B. Providing a cushion for the fetus. C. Protection against infection. D. Facilitating fetal movements. Hormone regulation is done mainly by the placenta and the maternal endocrine system. The amniotic fluid is a fluid-filled membrane that surrounds and protects the fetus during pregnancy. It acts as a shock absorber and it cushions the baby from bumps, movement, and external pressure. In option C, the placenta and maternal immune system play a bigger role in protecting the fetus from infections. The sac only provides a partial barrier. In option D, movement is possible because of the fluid, but cushioning is its primary role. So our answer here is option B. The amniotic sac also helps to regulate temperature and it allows the baby to move freely for proper muscle and bone development. Question 16. What is the primary biological role of the hormone HCG during early pregnancy? A. Initiating lactation. B. Stimulating uterine contractions. C. Maintaining the uterine lining. D. Detecting pregnancy in tests. Option A. Initiating lactation is done by prolactin and not HCG. In option B, stimulating uterine contractions is done by oxytocin during labor. In option C, the HCG is actually produced by cells of the developing embryo shortly after fertilization. Its role in early pregnancy is to signal the corpus luteum to continue producing progesterone. Progesterone maintains the thick, nutrient rich uterine lining needed to support the developing embryo. Now, without HCG, the corpus luteum will degenerate, the progesterone levels will drop, and menstruation will occur. So, in early pregnancy, HCG maintains the uterine lining by signaling the corpus luteum to continue producing progesterone. So our answer here is option C. Question 17. What is the purpose of the meconium in a newborn's bowel movements? A. Providing immunity. B. Digesting nutrients. C. Eliminating waste products. D. Clearing respiratory passages. Immunity basically is provided in the colostrum in the mother's breast milk. So, providing immunity is the role of colostrum in the breast milk and not meconium. In option B, digestion begins after birth with milk that is given to the baby. Meconium does not digest nutrients. Meconium is the first stool that is passed by a newborn, and this is usually within the first 24 to 48 hours after birth. It is composed of intestinal secretions, amniotic fluid, cells that have been shed from the guts, bile, and mucus. And its main purpose is to eliminate waste products that have accumulated in the intestines during fetal development. In option D, newborns clear their airways with mucus and suction at birth. but not meconium. So our answer here is option C. The purpose of meconium is to eliminate waste products that have accumulated in the intestines during fetal development. Question 18. Which organ is responsible for producing hormones such as estrogen and progesterone during pregnancy? A. Uterus. B. Placenta. C. Ovary. D. Adrenal gland. The uterus provides a site for implantation and growth, but these do not, but it doesn't produce hormones. During pregnancy, the placenta takes over hormone production from the ovaries. It produces the estrogen and progesterone that are essential for maintaining the uterine lining, supporting fetal growth, and preparing the breasts for lactation. The ovary produces estrogen and progesterone before and during early pregnancy, but as the pregnancy progresses, the placenta takes over. The adrenal gland produces cortisol and some other hormones, but um, they are not the primary estrogen and progesterone required for pregnancy. So our answer here is option B, the placenta. It takes over from the ovary and starts producing estrogen and progesterone during pregnancy. Question 19. What is the purpose of the fetal movements felt by the mother during pregnancy? A. Indicating the baby's gender. B. Initiating the onset of labor. C. Strengthening the uterine muscles. D. Facilitating the development of the baby's muscles and bones. For this, we'll be going with option D because fetal movements do not indicate the baby's gender. Labor is triggered by hormonal changes and not fetal movements. The uterus itself is strengthened by pregnancy hormones and stretching and not fetal movements. The fetal movements, which are also known as quickening, they are felt by the mother around 18 to 28 weeks of pregnancy. And these movements are important because they help the baby to exercise their muscles and joints. They also promote proper skeletal development, and it indicates that the fetus is healthy and active. Question 20. Which condition is characterized by high blood sugar levels during pregnancy? A. Type 1 diabetes. B. Type 2 diabetes. C. Gestational diabetes. D. Hyperthyroidism. Type 1 diabetes is an autoimmune condition that is diagnosed before pregnancy, but this is not caused by pregnancy. Type 2 diabetes develops in adulthood due to insulin resistance, but it is not triggered by pregnancy. Gestational diabetes is a form of diabetes that develops during pregnancy in women who did not previously have diabetes. It is characterized by high blood sugar levels due to hormonal changes that affects the insulin function in their bodies. Um, Hyperthyroidism is as a result of an overactive thyroid and it affects metabolism, but it is not directly linked to high blood sugar. So, based on the options we have, the answer would be option C. Gestational diabetes is characterized by high blood sugar levels that is triggered during pregnancy. This brings us to the end of the multiple choice questions on human pregnancy. Don't forget to like, comment, and share. And also hit the subscribe button so that you'll be informed when our next informative video will be dropping. Thank you for watching, and I'll see you in the next one.